Okay. All right. Well, yeah, we get started because we have a jam-packed session, and this is a exciting one. So welcome and thank you. I guess basically what we'll be talking about is, I guess, being saved or saving someone is often, it is joyful, and it's often perceived as it should be just joyful. But the reality is it's much more complex than that. And gratitude does exist alongside other emotions, whether it's grief, fear, guilt. And today I think we're going to talk about some of those um, real and unspoken emotions in a very safe space. So thanks again, Amy, for letting the Canadian Transplant Association tap into your wealth of knowledge and sharing it with us. So thank you.
All right, thanks, Kathleen. So hi, everybody. Once again, thank you so much for being here. And I just want to acknowledge you taking the time to show up for a conversation like this. So I'm glad you're here. My name's Amy Haertel. I'm a registered social worker and psychotherapist in Ontario.
Grateful and traumatized is the name of this.
Yeah. Hi, Corey.
Hi.
All right. So before we begin, just want to make a important note that this presentation isn't a replacement for therapy. It's not individualized care, and just what I'm sharing is generalized psychoeducation, and themes that I observed in practice, working with individuals navigating through medical trauma. Um, any ideas, or they're just ideas, patterns, strategies many people have find helpful, and they also are responses to the questions and themes that came from the survey that was conducted in the transplant community. So these topics come up a lot in my work, and it's often something people don't always have the language or space to talk about. So my hope today is just to offer some understanding, some language, maybe a sense that, um, if parts resonate with you, you're not alone in that. And again, just thanks for being here. So let's dive in. Okay, so why can being saved still hurt? So from the outside, transplants, they they look like a miracle. They are a miracle. Medically, it's a beautiful, awesome, wow kind of advancement in modern medicine. But emotionally and psychologically, transplants can bring up some very complex, sometimes um, contradictory, I'm stumbling on that word, like contradictory. Anyway, different emotions that contradict each other. People might feel like grateful and overwhelmed, relieved and scared, hopeful and grieving. And sometimes those emotions can all exist at the same time. So that can be a little bit confusing if no one kind of talks about that. But it's actually a very normal response to trauma and survival experiences. Okay. Um, just quickly touching on this, kind of like the cultural narrative about transplant. So the story often sounds like you got a second chance, you must be so grateful, everything must be so much better for you now. And while those things can be true, it's only part of the story. So the reality is, and maybe some things that get left out of the conversation, is just the emotional and psychological complexity of surviving a life-threatening medical experience. So when people go through serious illness or are waiting for a transplant, we talked about this before, your brain kind of shifts into that survival mode. And in that survival mode, once again, your mind is focusing on appointments, medical decisions, treatments, and just getting through the next step. And there often isn't space to process those emotions during that time. So, what frequently happens is the emotional processing kind of happens. It is happening during, but it really kind of lags, and it happens after transplant. And that's when your system, your body, and your brain really finally has a little more room to slow down and start processing. So that can surprise people. You might think, I should feel better now. But what's actually happening is that the brain and the nervous system are starting to process what has happened. So we're going to talk a little bit about survivor's guilt. It's very common in the transplant community. This is really complex in your community in particular. Um, but survivor's guilt is when, um, I mean, it's very predictable. It's psychological response to surviving what you went through. Um, it's not a character flaw or a sign of ingratitude. Your brain is actually wired to search for meaning and explanations, especially after something intense happens. So when something big happens, like transplant, your brain naturally will start to question things like, why did this happen? Why me? Why did I survive when others did not? And your brain, it doesn't really love unanswered questions. So what it does is it often will fill in any kind of uncertainty or unanswered question with some blame or guilt, even if the situation is completely outside of a person's control. So in transplant, lots of variables involved there, your organ availability, the matching systems, medical timing, donor circumstances, lots of variables involved in survivor guilt for you. Um, but none of those things are actually in a recipient's control. But emotionally, the brain struggles to really accept that. And then the transplant experience is also really layered, and recipients, you're often becoming very aware of that larger transplant community. So, like the people waiting, other people that are struggling, people who are did not survive. Um, and that awareness can really deepen your empathy. Empathy can sometimes turn to guilt. And survivor's guilt is really the mind just trying to process that the experiencing, like you experience surviving when at one point survival felt very uncertain. So your brain is really trying to process that you did survive and filling in a lot of blanks and or uncertainty there. Understanding that can help reduce some shame around those feelings. And you want to try to go to moving from guilt. If you notice survivor's guilt in yourself, or if you're noticing someone that you care about with that, you kind of want to go and help the brain to find some meaning. Okay, so one of the shifts that can help people move through that survivor's guilt is moving from the question, do I deserve this? To that different question about how do I live with this experience? And the survivor's guilt is kind of keeping people stuck in a more self-questioning or self-critic or judgment kind of mode. Um, but this meaning making sometimes will help shift into a more healing mode. And that meaning making, it doesn't mean that you're forcing a positivity, you're forcing only positives, or pretending that this experience isn't painful. It just means asking um like these questions here. So what does that experience mean in my story? um some people find meaning through a lot of different ways, connecting with others in the transplant community, advocacy or awareness work, supporting other patients, deepening your own personal relationships, or just simply living in a way that reflects your values or what matters most to you. So there's no single right way to do it. Um, for some people, it's very quiet, it's more personal. And for other people, it can mean something a little more visible, like dressing up in a unicorn outfit and going to the parade. I saw Kathleen's picture this week, so that reminded me of that. So, really important there is for you to understand that a person can hold two truths. So, I feel sadness about my circumstances of transplant, and I want to live my life in a meaningful way. So, meaning doesn't erase your grief, it simply allows grief and gratitude to hang out side by side. Okay. All right. So, here we're going to be talking about gratitude versus gratitude pressure. So this really comes up frequently in transplant recipients and family members as well. And there is a difference between that authentic gratitude and gratitude pressure. So authentic gratitude is something that usually develops naturally over time, might show up in those quiet moments, just appreciating being alive or appreciating um, being able to travel. Um, in relationships or just in the overall general like opportunity to continue living life. Authentic gratitude doesn't require that every other emotion disappear. You can feel grateful and still feel sadness, fear, grief, exhausted, and those emotions don't cancel each other out. Whereas gratitude pressure, on the other hand, happens when people feel like they should or must be grateful all of the time. And that pressure, it is actually coming from many places. Um, so like, social constructs we have, maybe that are a little more subtle, or maybe it's coming from people making comments like, oh, you're so lucky, you got a second chance, you should be so happy. Um, and yeah, like those comments are usually meant very kindly, but sometimes you can hear this underlying message of I'm not allowed to struggle. And when that happens, many people start to suppress the more difficult emotions because they don't want to seem ungrateful. But that emotional suppression often creates distress over time. Okay. But when we allow space for both of those experiences, the pressure actually decreases a little bit. So when the pressure to feel grateful disappears, that authentic gratitude often will grow more naturally. Okay. So, shame around difficult emotions. Lots of different emotions that you might feel. These are really kind of top level emotions I've listed here, but these emotions can get really subtle, can maybe be hidden a little bit. Um, but many recipients feel a little bit ashamed when difficult emotions come up after transplant, and you might think, I shouldn't feel this way. I should, once again, only feel grateful. But as we know, emotions do not follow rules. And when your system, your brain and your body goes through that trauma or extreme stress, those emotions can appear like in waves or feel like they just pop up and like this blanket gets thrown on you almost of these emotions. So that sadness or anger or fear, it doesn't mean that you're ungrateful. It means that you're processing something. You're processing something very significant. All right. So many recipients and family members too, caretakers as well. Um, you kind of might notice a shift of this over time where early after transplant, those emotions can feel really raw that are coming up. They can feel maybe confusing or overwhelming. Um, but from my experience working with people, after you really start to get a better understanding of your survival responses, of your nervous system responses, and of how the brain actually processes things, um, many find that landscape, like your emotional landscape, becoming more understandable or even manageable. Okay, so healing, the key point here is just once again that healing involves making room for like the full story, not just one, storyline. It's kind of like every page in the book, not just one page. Or it's the parts that it's not just the uncomfortable parts or just the comfortable parts. It's kind of the whole book. All right, so living life after facing death. So many of you, um, transplant recipients um, and caretakers or family members, you face something that people don't really have to confront directly a lot. You faced someone that you love's mortality, your own mortality, and some transplant recipients, you're experiencing the preparing for the possibility of death, saying goodbye to a loved one. You're making end of life plans, long period of uncertainty there, pre-transplant. And, surviving that can bring that relief, but also emotional aftershocks, right? So, you want to think about how emotionally complex that is to continue living after you thought that you might not make it. So, a lot of people really spend months or even years in this state where survival continues to feel uncertain. And during that time, many people have had conversations that most individuals don't expect to have till later in life. Some people are you're talking to your families about what would happen if you didn't survive. Um, you're having those conversations that feel like you've said goodbye. Um, and even when those conversations are practical or medically necessary, they leave a footprint, they leave an emotional imprint. And the human brain, it's just not wired to easily move on from experiences that felt that survival was uncertain. Um, so when someone survives after that kind of experience, there can be this strange disorienting adjustment period. All right, where you're struggling again with those big contradictory emotions. So relief that the surgery happened, relief that your body is recovering, relief that life is continuing, but at the same time there can be a lot of fear and sadness, and you can feel scared that you've actually noticed and you've experienced how fragile life can be, right? So, and maybe there's fear too because you've witnessed how other people responded to that. That can cause a lot of worry or disappointment on like what would have happened if. Mhm. Okay. So before transplant, death might have felt like a distant concept, like before, like even knowing that you're ill and you might need this transplant, it might feel like a really distant concept. But after facing it directly, that awareness can stay really close to the surface. And some people describe feeling like they now know something about life that maybe other people around them don't fully understand. There can be sadness connected to what happened during your illness, about the time you lost, about how difficult that journey is, about how sick you had to become, just about how your life changed. Um, some people might, you might feel that grief about the version of yourself that existed before you got sick, before you even knew that you might be having to have this transplant. And then that there's another layer too, that when survival finally happens, people often expect themselves to immediately feel like super happy or relieved. But once again, that emotional lag might come in there, and you might still be catching up. So it might like processing that fear that existed during a time when survival is uncertain. Once again, it comes a little bit after that transplant is successful. Um, okay. So yeah, this is just another idea of kind of just holding those multiple emotions at once. It can be really incredibly helpful. That person can feel hopeful about the future and still feel sadness about what you went through. Remind yourself here that that's part of that mind and body integrating that life altering experience. And yeah, just kind of thinking about allowing and acknowledging like two emotions at once or multiple emotions at once. Once you kind of do that and you kind of acknowledge that it's all there, your emotions will actually begin to settle a little bit. You're not shoving something away, and they'll start to make maybe a little more sense for you. All right, so I'm going to dive into and share some helpful approaches and strategies with you. So today I'm actually focusing on some cognitive strategies. So that's like, brain work, like thought work. And in our next webinar, we're going to talk more about the body responses and strategies. So remind yourselves here that these are very general, they're not individualized, and they're not detailed, and they might work for you, they might not work for you. It might matter to you, it might not. Just try to take from this what you can as it relates to you. Okay. So there's something called cognitive behavior therapy, CBT. This really helps us understand how our internal experiences are connected. And often CBT is something that gets recommended a lot by physicians and things like that. It's very evidence-based. It's really, really studied. So this really works with your thoughts, okay? Cognitive behavior therapy, one of the parts of it is this thought triangle here, which I always like really love to mention to people. It just helps you kind of maybe really start to like be able to conceptualize that our thoughts are connected to our behaviors and emotions. And they're not going in like I'm going to have a thought and then I have an emotion and then I have a behavior. These are kind of linked together, where let's say you had a thought first and then maybe you have a behavior and an emotion appears. You could also do a behavior and a different thought, and then a different emotion could appear. So, this is kind of showing here just that relationship between our thoughts, emotions, and behaviors. And each part of the triangle here influences the other part of the triangle. So, just for example, here, a thought might be, I should feel grateful, kind of like, I'm fine, you're fine, everything's fine. Um, these thoughts are automatic and they show up really quickly. They're fast, they're often even unconscious. So they're shaped by our experiences that we have, our beliefs, and what we've been told by others. So when that thought shows up, maybe it creates an emotion like sadness or guilt or a feeling of overwhelm. And then those emotions could then influence behaviors. Like maybe you withdraw, maybe you avoid conversations about your more difficult emotions, or maybe you start like pushing those other emotions away. And then that cycle kind of continues. Okay. So, what CBT does is it's helping to kind of bring awareness to these different elements, and it helps to slow this process down. So it helps sometimes when you start thinking to yourself, like, what am I telling myself right now? Is this thought helpful to me? Is it adding to the pressure? Um, and there's some great psychoed in CBT that talks about thought traps or cognitive distortions. And those are patterns of thinking that feel really convincing, but aren't always fully accurate, and they're not always helpful. They might have been helpful and adaptive at one point, but maybe that's not the case anymore. So, for example, some common thought traps might be a little bit of all or nothing thinking, like I should either feel grateful or something's wrong with me. Should statements, I should feel differently than what I do. There's a lot of maybe mental filtering. It focuses on what feels hard. And then you might miss some progress or some moments of relief. Mind reading is another one. So people will think I'm ungrateful if I talk about how I really feel. Catastrophizing, this is a common one, especially if you have anxiety or if you're noticing anxiety, if you've had it pre or post. Catastrophizing happens a lot with anxiety. So something like, I'm not feeling happy. That must mean I'm really sad. Sad's not good for my body. I know sad might hurt my body. I have to release this. How do I release this? Oh my gosh, I can't release this. I'm I'm gonna have to, I'm gonna get sick if I can't get that out of my body. And then you kind of see where that goes into a more bigger catastrophizing there. Emotional reasoning is another one where because I feel scared, something must be wrong. Or because I think this thought, something must be wrong. And then personalization is another one. Um, it's somehow my responsibility to make this life worth it, to make this whole experience worth it. And you really personalize that experience. So, obviously for everybody that would be really individualized. I find that in the ones that are really obvious are the catastrophizing and mind reading, um, and maybe that all or nothing kind of thinking in the transplant community. But you might find yourself some in one of these other thought traps. So really what the whole point is here is that you notice them. And once you become aware of them, you can label them and kind of tame them a little bit. You can be like, oh, I'm catastrophizing. Okay. What could be more helpful? What thought might be more helpful? Or where is the evidence to support this thought? So you can start to recognize the pattern, um, and once you do that, the the thought feels less like a fact. And it's something that you can take a step back from and observe. And that creates that little bit of space, that little bit of slowing down.
I know you got a new car. Hi. Do you have the new car? No.
Oh, I think your mic is on there.
Oh, sorry.
Oh, that's okay.
Sue.
Oh, I think it's still on there.
What did you do? Why did it turn it off?
That's okay. We'll keep going. But yeah, so you can kind of think that those thoughts feel less like a fact, and that creates that little bit of space. And it's not always forcing you to think only positive thoughts. It's more like you're becoming aware of how your thoughts are shaping your emotional experience or some of your behaviors. And then it's just like gently questioning whether that thought is helping, whether it might be harmful, where it was helpful before, and how maybe that's changed now. So sometimes when we understand our thoughts, um, well, you can kind of, a lot of people are actually really good at understanding their thoughts. You kind of know something, um, but you're still left with a lot of those emotions that are happening. So that's kind of where this next step can come in handy with DBT. So, DBT is dialectical behavior therapy. That one of the main thing it's doing, I mean, there's mindfulness in there. These are all very large concepts that we could have webinar upon webinar on. But one of the main things that I like to talk to about with people is the idea that two things can be true at the same time, even though they conflict. So your brain actually prefers really simple emotional stories. So we like to make sense of things in clear categories, it organizes experience as simply as it can. So I'm either grateful or I'm struggling. I'm hopeful or I'm scared. It was a good outcome or a traumatic experience. But in real life, I mean, both of those things can be true at once. It's rarely as simple as that. So, and transplant in particular is one of those experiences where multiple emotional truths are existing at the same time. So, someone might feel deeply grateful for the transplant, and at the same time, you're still processing a fear of almost losing your life. Um, you might feel hopeful about the future, but still carry that sadness that the illness brought in the first place. So, really, this concept, this theory helps people move from that either or thinking to both and thinking. So, instead of saying, I should feel grateful, so I shouldn't feel sad, this approach has a bit of a change in your own internal language, where it's, I feel grateful for my transplant and I'm still processing how scary that was. So it keeps both of those emotions very valid. And part of the reason that this can feel confusing is that once again, that brain is really preferring those simple explanations and singular emotions. But trauma and survival experiences, well, they're overwhelming. They overwhelm your system, they overwhelm your brain. And they happen in like these layered emotional responses. So when someone goes through something life threatening, your body and your brain, it's storing lots of different parts of that experience: fear, relief, grief, hope, gratitude. So when that emotion comes up later, we can't expect them to just be coming in one at a time, and they're just coming up together. And sometimes the most helpful thing we can do is to just allow the emotions to exist without trying to force that single storyline again. And you can kind of think about this like if you're feeling like, anger and exhaustion, and you're feeling like grateful and hopeful for a future. Sometimes if these more energy related emotions come up in big, higher volumes, and it kind of hijacks those other feelings. So we want to kind of think about holding these multiple emotions at once at the same kind of volume level. All right. So it's allowing the mind and body to acknowledge the full reality of the experience rather than just like one emotion or one small piece of it at a time. So this one, I kind of want you to take a moment here and just think about your transplant journey. So just kind of notice like some of the emotions that you find that you're holding. All right. So just kind of maybe finding hopeful about the future, but also afraid because you know how fragile life is. And you're still, after transplant, continually managing meds and lots of different things for a lifetime. Okay. So if you can gently identify two emotions that have existed, like see if you can do this, two emotions that exist together for you. You don't have to analyze them or judge them, you're just noticing them. And I want you to try to frame them now in that dialectical DBT way, using the word and. So I feel grateful and I'm also exhausted. I feel relieved and I'm still processing what happened. So that small shift from but to and can be really powerful when you start to integrate that into your thought, into like that automatic thing that you go to. So when we say but, it often cancels out one of the emotions. But when we say and, it's allowing both of those experiences to exist together. So just notice that. If you want to write it in the chat, what you kind of notice there, maybe you can write one of your sentences there with and in the chat if you want to do that. We can take a look at that later. But what many people discover is that, once you can kind of see how these emotions are allowed to coexist, that internal battle between them really begins to soften. And that's kind of one of these core ideas of DBT, is that healing happens not by choosing one emotion over another and making one disappear. It's making space for the full emotional experience. Okay. All right. So another thing from DBT I find that a lot of people find helpful is the wise mind. So DBT describes these three different ways our mind tends to operate. So the first is the emotional mind, and that's the emotional part of us that reacts strongly based on feelings. So it's fast, it's powerful, and it's often really protective. Okay. So for someone who has gone through transplant, your emotional mind might say things like, this was terrifying. I almost died. I'm scared that this could all happen again. I feel overwhelmed. Now, the emotional mind is not wrong. It's responding to this really real experience that you went through. Okay. Then the second state is this reasonable mind. And the reasonable mind focuses on facts, logic, problem solving. And it might say things like, my transplant was successful. I'm still alive. My doctors say I'm doing fine. Statistically, my health is improving. And once again, reasonable mind is not wrong. But what happens here, if someone stays only in reasonable mind, they might dismiss their emotional experience. So they might say things like, I shouldn't feel this way. I should just be grateful. Other people have it worse. And when the emotional mind and the reasonable mind are separated like that, that's when you're going to feel that internal conflict. Excuse me. So one part of you feels scared or sad, but the other part is saying that you shouldn't feel that way. And that's kind of where this middle section, the wise mind, it comes in. And the wise mind is where emotion and logic, they come together. It's a place where you can acknowledge the full reality of your experience. And that wise mind is going to use that and language. Transplant saved my life, and it was one of the scariest experiences I've had. Or I'm grateful to be alive, and I'm still processing everything my body went through. So that wise mind allows both truths to exist without forcing one to cancel each other out. All right. So let's see here. Yeah, so the wise mind also tends to feel more grounded and compassionate. Instead of judgment, it's bringing curiosity, which is my favorite word. You want to kind of think about curiosity and maybe shifting a little bit of judgment or self-criticism to how can I be more curious about this? Curiosity often brings that a little more understanding and a little softening as well. when you begin to operate from that more wise mind space, your system, like your emotional system, your body reflexes, different states, it becomes a little less chaotic. Because the brain, you're cognitively not fighting with yourself. Instead, you're able to kind of hold the complexity with a little more stability. All right. So, and you know, this is a process, right? So your this healing after transplant really involves moving toward this. In survival states, you might not automatically, you might need to go to a more emotional or more rational mind. So you want to think about this gradual move toward wise minds. Okay. And once again, it's really kind of adding to that full narrative of what has happened. Okay, so I kind of made a few things up. I made a few up for other clients, but maybe you see yourself in some of these. Um, but yeah, for you right now, even it could be helpful to notice which voice has been a little louder lately. Has it been the emotional voice or the emotional mind? Has it been that reasonable mind trying to push other emotions aside and just focus only on that physical recovery? Or have there been moments where your wise mind shows up? And even just noticing that can help you to shift toward a little more balance internally. Okay. Okay. So another part is another thing that really helps people try to kind of wrap your mind around the cognitive work that you can be doing is the idea of self-compassion through parts work. So parts work, I mean, some people might have heard of internal family systems or parts work. Um, this is kind of like the idea that our minds are made up of different internal voices or internal parts, each trying to help us cope with different life experiences. So these little voices, it doesn't mean that something's wrong with us. This isn't like a voice that's telling you to harm someone else or things like that. That's something different. But these are kind of voices that um, are parts of us that kind of come up and they can play different roles, like really protective roles, really organizational roles, manager roles. They can be in a crisis response role, things like that. All right. So having these different parts is normal, and it's really a healthy way that your mind organizes different experiences or parts of life. Um, so after a major event like a transplant, different parts of you might react in different ways. So, for example, one part of someone might feel incredibly grateful to be alive, and another part might feel scared. So, um, I like to try to think about just, a whole bunch of parts of us, like at a party or at a table. That's a really common one in therapy, where you're thinking about all the parts of you just kind of sitting at a table. And like in my mind, we got like intellectual Amy, fun Amy, adolescent Amy. So fun when adolescent Amy turns up the volume. She's a great one. But we just kind of want to think about all these different parts of us and when they come up and ways they've kept us safe in the past, and maybe think about what it is they're trying to say in these moments that we notice them. So from this part's perspective, um, these emotions or parts of us that are pulling in different directions, it actually makes a lot of sense because each part has developed to protect us or help us survive something difficult. So, for example, that fearful part might be trying to protect you from future danger. A strong part or a stay positive part might be trying to help you just keep moving forward. That grieving part is trying to acknowledge what you lost during your illness or different parts of your life that aren't the same. And none of those parts are wrong. They're all just trying to help in their own way. And that's where, like, identifying this like central self or a self-compassionate, healthy kind of health, a middle mind, or even you can use that wise mind there to kind of think about that is the self-compassion that shows up, and maybe is at the head of the table, where that self-compassion is how we relate to these different parts. And, people often respond to difficult emotions with that inner critic, say something like, you shouldn't feel scared, you should be strong, just be grateful. But when we approach these different parts with curiosity instead of criticism, something really different starts to happen. And instead of fighting the parts of ourselves that are struggling, we start to maybe see them, hear them, understand them a little better. So once again, for example, there might be a part of me that still feels scared after everything my body went through. Or there's a part of me that feels grateful, and another part that's grieving the life I once had, you know? So this language, or this idea of way of looking at all these things, can help everyone kind of sit at the table at equal parts and kind of have those different parts of us exist without forcing them to compete for our attention. Okay. So when you start to begin to acknowledge your parts with a little more compassion, you kind of befriend your emotions, or you befriend all these different parts of you. These parts often begin to settle a little bit, and they don't have to fight so hard to be heard or acknowledged. So that self-compassion in parts work isn't about forcing yourself to feel a certain way. It's about creating enough internal safety that all of your parts, or all the parts of your experience, can be seen or acknowledged. And that internal understanding allows for that healing and that integrated story to happen over time. All right. Okay, so just noticing the time. I'm going to skip a few little parts here, but this is just a little part I made up for a client in the past, just kind of thinking about all the different parts. And you can kind of see that self or wise mind maybe in the middle, and just kind of understanding here that the goal of healing isn't to eliminate the parts, it's to allow them to be understood. And yeah, you can kind of like think about that. I sometimes want to think like their adult self, their current self, their understanding self as the middle person, the kind of the head of the table or the host of the party, and just kind of, touching base with all these different parts of us. All right. Okay, so once again, you just kind of want to think about when you can relate to those internal parts, with some self-compassion. Those parts will begin to relax, and you want gratitude to exist, fear to exist, exhaustion to exist. All those parts can belong to that same story, can belong at that table. Okay. All right, so as we come to the end of the conversation, just want to kind of go back to the question we started with about being saved, and like why being saved can still hurt. We've talked and explored a few different ways to understand that question. We talked about survivor's guilt, how it's really common once you've experienced a life-threatening situation. You might wrestle with those questions about why you live and others did not. We talked about CBT, the triangle, those thought traps that you might find yourself in. You can actually Google CBT thought traps. Lots of limited thinking patterns. They kind of like come up, and you might be able to find yourself in there. There's great resources on what to do if you notice yourself catastrophizing, maybe questions to ask yourself. It's a great thing for you to kind of explore a little more. We talked about the idea from DBT, which reminds us that two truths or multiple truths can exist at the same time. We talked about wise mind, which is that middle part of the Venn diagram where emotion and logic get to hang out together. It's the part that can say this experience saved my life and was incredibly hard. And then we talked about parts work, which recognizes all these different parts of us that might respond in different survival ways or protective ways, and how none of these parts are wrong. It's all just a piece of this very human experience or very human response to a life-threatening or life-changing experience. And, the goal of healing is not to force any of those parts away, but to allow them to be understood and held with compassion. Okay. So, sometimes we also talked about life after facing death and the meaning and maybe how to carry that complex emotional story. It's much different than maybe one we had before. And it's that story where all these emotions can exist together. All right. So if you recognize parts of yourself in anything we talked about today, know that you're not alone. Many transplant recipients and people involved along the transplant journey, um, they've experienced them too. They share those experiences with you. And your reactions, they all make sense. I think that's another really important point. Our reactions are all adaptive. So it's just kind of like understanding them a bit more can be really helpful, right? So healing begins by not trying to necessarily change how we feel, but by allowing ourselves to be able to hold all this truth about everything you've lived through. So if parts of you feel grateful and other parts of you are still hurting, it doesn't mean that something's wrong. It means your experience was real, is real. So yeah, just thanks a lot for being here today and for taking part in learning and taking part in the conversation. And yeah, just thanks so much. And we got a few minutes here for questions. So if you're watching online, thanks for watching. And I'm just going to stop the recording now. And then we can take some questions. So just hang on one sec.